Could you give me a brief biography, schooling credentials, and your basic job description?
Yeah, so my biography, I actually have a Bachelor's of Mass Communication. That's from the University of Buea in Cameroon. Then I moved over to the US in 2005, and that's when I got the Masters of Business Administration. In 2010, I started with the Masters of Public Health. Got the Masters of Public Health in 2012 from Walden University, and then I proceeded with a PhD. Got that in 2014, Walden University. So that's my educational background. For professional background, I had started a non-profit organization called Gospel Impact Missions, and that catered for the needs of HIV patients in Cameroon. So that's why it got me interested in the field of public health in general. So currently now I started a non-profit called Community Health Education and Research Corp. It's a non-profit that we get grants from the county and the state and the federal government, and we carry out some health programs like diabetes prevention. We do cardiovascular disease prevention. We do mental health. So I am the CEO and founder of that organization, and that's currently what I do now. And then I also teach. So I teach for Anne Arundel Community College, for iGlobal University, and for Prince George's Community College, all part-time.
You answered my second question.
Yeah.
What drew you to the occupation?
Okay. Okay.
How do you use social determinants of health in your work?
Yeah, social determinants of health are actually one of the most driving factors for me, what pushed me to get into the field of public health, because I realized that there is so much social injustice as regards to access. Access to healthcare. There are many people that do not have access. First, either because of lack of information, second, because it's expensive, and then third, because of the healthcare system that serves as a trap to lure some people away from the system. So those social determinants of healthcare, that's really what pushed me to start this non-profit organization, because I felt like I could help bridge that gap and get more people access, especially preventive education. So instead of them getting sick, they can find ways of not getting sick. And I got into that because that's one of the biggest issues with America. This country spends the most amount of dollars on healthcare, more than any other country in the world, but we are not amongst the first 30 healthy nations. That's because we focus more on healthcare. You are already sick, how can we get you well? And they don't focus on prevention to prevent them from getting sick, which would save a lot of dollars on healthcare. So that's also part of the social determinants. We have health disparities, which is a big one too, which goes into different sectors, different ethnicities, different races, how they're not, or they don't have the right information, the right equipment to receive the health care that they need, which correlates into the diseases that they also get, which is all housing, income, and all that stuff. So they are interrelated, and that really pushed me, and that's all part of the social determinants of healthcare.
Okay. Well, my next one is like two questions in one. How do you utilize social and behavioral interventions and health communication information to improve the health of patients or the community?
So what we do, especially with the grants that we get from the state, currently now we have 2 grants from the state. So we have a cardiovascular disease grant from the State Department of Minority Health. So what we do with that grant is we advertise. We go to health fairs, we do events bright, we partner with different non-profit organizations in order to host these classes. And the classes, they help in bringing people together to talk about nutrition, they talk about diet, they talk about exercise. So those are some of the behaviors that we want people to incorporate in their lives, so it can become more like a lifestyle change, which factors into them getting very healthy. And then we have another grant from the State Department of Healthcare Quality, and that deals mostly with mental health. So with that grant, what we're trying to do is we're trying to prevent people from getting mental health illness, which most common issues like depression, anxiety, substance use and abuse, to prevent it before it actually happens, so we can prevent some of the behaviors that we see around us, which are all caused as a result of mental health illness. So that's how we struggle to bridge that gap. Yeah.
Okay, and my last question, where did you learn the skills, knowledge to be successful in your career?
I would say from experience. From experience, mostly, I worked for organizations and I worked with people that were highly experienced in the field. So even though the theoretical part I got from education, but the experience that I really got interacting with people, having a need-based analysis, asking them what they need, interviewing them as you're doing right now, and they're telling me about some of their health issues, their concerns, how they are unable to get insurance, how healthcare is very expensive, some of the illnesses that they have but they cannot avoid. So for example, the low-income folks cannot afford healthy food all the time. So they don't really have a choice. They eat stuff that is not very healthy and that impacts their health, but they don't really have a choice because they are low income. So all this experiential knowledge really actually helped me to develop a lot of programs. Then we also do a lot of advocacy, policy advocacy. And what we do is we write to the Congress people, we march and we say, we have to get healthcare. Healthcare is a right, not a privilege, because if they consider it a privilege, that means the rich are going to get the healthcare and the poor will not get the healthcare. So all those factors I learned more from experience, but the theory aspect of it, it just feeds me with more knowledge about the programs, about health and really what to do. But yeah, both experiential knowledge and academic knowledge.
All right, thank you. That concludes my interview.
Oh, okay.